Hello everyone, my name is Dr. Fairul and today we'll be discussing about the first aid treatment in strains and sprains. Strains and sprains basically occur when there are injuries to the soft structure around the bones. These include the ligaments, tendons and muscles. It can be injured in several ways, but mostly due to overstretch and partially or completely torn by sudden or violent movements. Therefore, strains and sprains are commonly associated with sports. How to recognize strains and sprains? The sign symptoms: usually there's tenderness and pain at the injured site, and the injured part is difficult to mobilize, especially if there are swelling and bruising in the area. The aim of first aid in strains and sprains: one is to reduce pain and swelling, and second is to obtain medical help if required. First aid treatment for strains and sprains. Firstly, support the patient to sit or lie down. The injured part should be positioned in a comfortable, preferable in raised position. Apply a cold compress to the injured area using an ice pack in a towel. This will help minimize blood flow to the affected area, thus reducing swelling and bruising, as well as reducing pain. Maintain the cold compress at the injured area or wrap an elastic bandage around it. Secure it with a bandage that extends to the next distal joint. To further reduce swelling and bruising in the area, support the injured part in an elevated position. The circulation beyond the bandages needs to be checked every 10 minutes. If the circulation is impaired, the bandages must be loosened. Circulation is impaired when patients complain of numbness and unable to move the distal part. If the patient is unable to use the injured part, or if the pain is severe, arrangements should be done to send patient to the hospital. Otherwise, the patient should be advised to rest the injured part and to seek medical help if indicated. In a conclusion, strains and sprains are usually treated adequately using the RICE procedure. R. By resting the injured part. I. By applying ice pack or cold pad on the injured part. C. By providing mild and comfortable compression using an elastic bandage. And E. By elevating the injured part. Thank you very much, and I hope you have enjoyed the video. Have a nice day.